which, if they were our size, would translate to 18 million jobs. This is not rocket science. Same thing happened in Denmark, the same thing happened in the United Kingdom. We can do this. That's at the heart of her long-term strategy to revive the American economy. We've got to save the planet for our children and grandchildren. You have to prepare all Americans to participate in this economy, which means we have to make college, including community college and apprenticeship and training programs, affordable for all our young people. And this is a big deal. The cost of college education has gone up at roughly 3 times the rate of inflation, while the current government has withdrawn a lot of the college aid programs that we pushed to the forefront. In the 1990s, we added 13 million people to the ranks of those getting college aid. And the most important thing was this. We did it in a way that saved the students $9 billion in repayment fees by lowering their interest rates, and saved the taxpayers $4 billion because no students defaulted anymore. How did we do it? By allowing the students to sign a contract that enabled them to pay back their college loans as a small fixed percentage of their income, so that nobody was ever disadvantaged if they decided to be a teacher or a fireman or a police officer or start a small business. You could never be overly burdened. And this is terribly important. Hillary wants to reinstitute that, expand it, make at least 2 years of college immediately affordable to all Americans with tax credits that are refundable if you don't owe any income tax. And, importantly, say that people who go into public service work, if you're a teacher, a nurse, a police officer, a mental health worker, you do something that serves the public where you know you can never get rich and we can't get along without you, the service itself should constitute repayment of the loan, so that every year you serve, you pay something else. The third thing that's important about her plan is health care. We cannot, I will say again, we cannot rebuild the American manufacturing engine, and we cannot sustain our economy over the long run unless we provide affordable health care to all our citizens. Now, she knows more about this than anybody, you know, but she also has a plan that has been widely praised by labor and business, by health care advocates and doctors and other health care providers. And I think it's very important to understand why. We have the most expensive healthcare system in the world, but we can't figure out how to cover everybody. This is the only area on earth where we go around and throw up our hands and say, well, America is a can-do country on every single issue except healthcare. We just can't figure out how to do it. That's not true. We're in the fix we're in today because we let the financing tail wag the healthcare dog instead of the other way around. Whenever the tail wags the dog, you get in trouble. So this system costs you $700 billion more a year than any other country's system would if you dropped it in America. And I'm not just talking about the Canadian single-payer system, which has some delay issues we don't have. You go to Germany, you go to France, you go to Japan, all with better outcomes than we have, all their systems would cost you less. So Hillary's plan covers everybody, has proven cost controls to bring our costs in line with our competitors, and invest more in the one area where we're really deficient, which is prevention, keeping people well in the first place. Now, this is a very big deal. It's a very, very big deal. And I deal with this all the time because my foundation works on the problem of childhood obesity and the rising rate of diabetes among our children. And if we don't do something about that, you can make me dictator for a day, let me design a system and just give it to President Hillary, and we'll still be broke. We'll still be broke in 10 years. And more tragically, our children will have shorter life expectancies than we do. So she's got a great health care plan. If you like what you got, you can keep it. If you don't have insurance or you want to change, you can buy into one precisely like that, which covers members of Congress and their families with 250 choices. And you can't be denied coverage or gouged on the premium because you or a family member has a pre-existing condition. Now you say, well, how can you do that? Because the pools will have millions of people in them. A lot of you who've experienced problems in buying health care at affordable rates have experienced those problems in part because your insurance pool is too small. So 2 or 3 sick people with a big bill can bankrupt the person that's insuring you. They got to be able to make a profit based on prediction. But remember, every year, 80% of America's medical costs are consumed by only 20% of its people. The rest of us are just buying insurance. I was one of those people in 2004 when I had my heart surgery. I consumed a lot of your investment. But for most of the rest of my life, I've been as healthy as a horse, and I was paying in and didn't need to take out. That's the way the system has to work. So it'll be there for us when we need it. If you don't need as much coverage of the options, say for example your children are grown, but you want a good plan, you can buy into a plan just like Medicare, even though you're not yet old enough to get into it. And it will be much less expensive administratively. We're going to save a lot of money in health care delivery. Hillary was at the Mayo Clinic in Minnesota, meeting with some doctors, and a group that was not on staff there told her that if every person had a medical home and were cared for in the same way the people who enrolled in the Mayo Clinic are, it would cut health care costs 20% in America. 20%. If every person had electronic medical records, so you didn't have to answer the same questions over and over and over again every time you go to the doctor. And so they didn't have to perform extra tests because they didn't know whether you were allergic to something. And there were fewer medical errors. That would save $80 billion. 80. That's 80% of what it would cost us to insure it. So she got a good health care plan. And finally, in foreign policy, she believes to restore our standing in the world as a leader for peace and freedom, we have to do, first, we have to get out of Iraq as quickly as we can without making it worse. But, in a larger sense, we need to send 2 new messages to the world. Message 1, there are very few problems America can solve on its own. Therefore, from now on, we're going to cooperate with you whenever we can and act alone only when we have to, not the other way around. Message number 2. We are proud of our military and the men and women who serve in it, and we know we need one. In fact, we've got a big job rebuilding this one, which has nearly been broken by the Iraq obsession. But we also know in the modern world the single most expensive thing you can do is go to war. It's expensive in terms of the people who die, in terms of the people who live but are wounded for life, mentally as well as physically. In terms of the unintended victims whenever you set off big weapons, in terms of the people you make mad, and in terms of money. It costs us $120 billion a year in Iraq. So from now on, our policy is going to be diplomacy first with friend and foe alike, military force as an absolute last resort, not the other way around. Finally, she says to do all these things, we're going to have to reform the government. Begin by appointing competent people, not cronies, to really important jobs. Get rid of every single no-bid contract we can get rid of. They are causing us a lot of headaches. This Blackwater thing is just the latest example. And more than half the time, it's been more expensive than if government employees who are accountable provided the service themselves. Get rid of the practice of privatizing things for the sole purpose of taking middle-class taxpayers' money and giving it to wealthy special interests. I'll just give you an example. This example only affects the older people in the audience, but if you're younger, it affects you because it takes money away from other things. The Medicare donut